The second tab in the incident report is the injuries tab. This is really important to identify exactly where the injury is and what type of injury. So you've got lots of options if it's a pressure injury, and we know that it's to her coccyx, so it's 23. Not everything is going to be perfect, not everything's going to be the perfect location. You will next go down and we're going to look at pain. Is the resident in pain from the injury? It likely is probably pretty sore and burning, so we'll document that. We want to know their orientation at the time of the injury, so they're oriented ×4. Maybe they're bedridden and they can't get up, and that's really a factor in this incident. Maybe they're completely comatose and we're not able to rouse them at all, so we are doing all of the repositioning for them and they can't shift their weight. And then in the note, you're going to put a brief description of the wound. So we're going to say suspected stage 2 pressure injury, noted to resident's coccyx, the measurement, the appearance of the wound bed, the appearance of the wound edges, and then if there's any drainage and if there's any pain. So if you are seeing the resident later and you need to do a follow-up on this injury, maybe it got worse, or maybe now the bruising has gotten worse, or the skin tear is bleeding more, whatever it is, you can come back into the incident report and you can note if there was increased pain, or is there spreading bruising and it's now much larger than it was when you originally noted it, whatever it is. The next section is factors. And this is really important for skin integrity especially. So any of these could be factors. Some of them might not pertain to friendship, but will pertain to Oddfellows. I had a resident recently who got scratched on the hand by her dog, and it caused a huge skin tear. So the pets absolutely can be a factor. Rugs and carpet, if they were shuffling their feet and got a skin tear to their foot. Assistive equipment, if they're bumping their elbow on the arm of the wheelchair. Obviously furniture, clutter. Illness is really important to note. Have they been violently ill? If they had a lot of weight loss, are they dehydrated? Or those could all be increased risk factors for pressure injury development. If they've had a recent change in medication, maybe they're really sedate and now they're not able to get out of bed because of all of the medication. Is their memory impaired and they're not able to cue themselves to reposition and they don't recall all of the safety mechanisms we put into place, or they're confused. Incontinence and UTI are going to be big ones. Are they newly incontinent? Are they chronically incontinent of bowel? So it's also important to list any other information that you can think of. So if this is a resident who maybe Anita Bath refuses to be repositioned every shift, it's well documented, so that's the cause of her incident report. Or maybe she was newly diagnosed with C. diff and she's having lots and lots of loose stools and it's putting her at a really high risk for skin breakdown. Or she has ESRD and she's going to hemodialysis 3 times a week, and just sitting for that long is creating a lot of pressure. Maybe she has chronic kidney disease and she has paper thin skin, and so her skin tears just occur constantly. This is also a really good point to document any scars that you notice around the area, especially of the pressure injury. Patients who have previously had pressure injuries are at a really high risk of breakdown on those scars over the bony prominences. So if you see an open area and lots of scarring around it, that's going to tell us that they're at really high risk for continued breakdown.
And then I have a story about improper footwear that's kind of interesting.
Mm-hmm.
When I worked at the hospital, we had a patient come in and he was in severe heart failure, and he was carrying an extra like 15 pounds of fluid, and his family brought in shoes and things for him to wear so he could participate with therapy to get him more mobile. And his shoes fit properly prior to this sudden onset of heart failure, and did not fit when he was carrying 15 extra pounds of fluid, and his feet were huge. But they continued to keep putting his feet in these shoes to do therapy, and over a couple of days his feet were horrible. He had full thickness removal of skin all across the tops of his toes, and he had tissue removed from the arch of his feet, and a heel. He had heel pressures too, just from the shoes continually rubbing for 2 days while he was walking. So always think about that, about when you're putting somebody's shoes on who may have not had that issue before, or putting on a brace that somebody brought from home and maybe it was fine before, but now their leg is an inch bigger and it could cause rubbing. So think about those things.